All dentists in the U.S. tell me I need to replace my dental crowns that were done overseas ASAP, or I will end up losing all my teeth. However, the best dentists I know overseas tell me that it is perfectly fine. Who do I believe?
Great question. This is one of the common problems that we see in the United States, and we have a multi-ethnic and multicultural country that we live in. And I see Texas is big, and we see people from all ethnicity. I see people from Mexico or any type of Hispanic countries, and I see people from South America. I see people from India, Asia, or any other countries that you can think, African countries, you can think of. So the challenge with some of the developing countries, and I did all my education from India. I got no problem in saying I came from a developing country, and we had great education. We got great support. We got some great teachers, and I got no problem in saying that. And as you know, it's a developing country, and sometimes in some of these developing countries, there is not much of a standardization in the technique. And you may be a great dentist that you're practicing, and sometimes the support system that you have, the lab that needs to make the crown, they may not be doing a standard or the industry standard type of crown the patient is going to need. So although you may be a great doctor, if you're not working with a great lab, or the lab is not up to the standard of the quality that is compared to the international standard, so sometimes you may not get the best type of dental work. And I'm not generalizing that not all the labs don't do good work, and sometimes you may be in an area that you don't have access to those great labs. And the gentleman who's talking about this right here, getting the dental work done, I don't know where exactly it was done overseas, and I can't tell you which part of overseas, whether it is a metropolitan area, whether it is a rural area. So we cannot standardize. So problems that we see here is the quality of the work that was done by the lab that may be substandard and may not be comparable to the standard of care that we see here. And the reason we say that you need to change the crowns is because we compare that to the standard that we see in the United States, and we have some standards that has been set by the dental schools, and also we do have some state standards that are set by the dental boards, American Dental Association, or in our case, I practice in Texas, and the standards set by the Texas State Board of Dental Examiners. So every state has their own rule set what is the standard of care should be. So when those standards are set by the government or by the government officials, and we have some guidelines that we follow, which are not typical for the developing countries, and there are some substandard or subpar work that has been done, and that's why we say that sometimes we see these crowns and they need to be changed, just in the best interest of you. Not that those crowns are not going to break in the overnight. For example, I have crowns in my mouth. Some of the damage has been done pre-dental school. I have some crowns in my mouth, and these crowns have been lasting for the last about 25 years. I got no problem. And some of these crowns were actually done in India when I was in dental school, like I said. And one of the things that I learned after coming here, and just like I said, this was done by one of my teachers, who's a great prosthodontist, when I was in dental school, and we had to do some of the best materials that were available about 25 years ago. So guess what? The technology has changed. So now we are able to get better materials. Mm-hmm. So now recently, within the last about 10-15 years, and I have changed some of those crowns, and The crowns fit much better compared to, not that something bad was something wrong with the crown. Like I said, it was done by a great teacher of mine, and some of the best materials available at that time. But now we have replaced them. Now they even feel better, and I think I have a good feeling that these are going to last for maybe another 10, 15, 20 years, and as long as I keep my teeth clean, and they are going to last for a long period of time. So again, going back to the question this gentleman had, whether these crowns need to be replaced. So it depends on where you got them done and who's saying why it needs to be replaced, and then just ask the honest question. Hey doc, if you're going to a dentist, just ask him the honest question, hey, why do you think that needs to be replaced? And they should be able to give you an explanation, and based on the information you get, you should be able to make an informed decision, and that's the way to go for it.
Mm-hmm. Yeah. Sounds good. All right.